All right, so now we're going to be doing the integumentary system prep requirements. So, number one, there are blank major layers of the skin, the blank, blank, and blank, also known as the hypodermis. Number two, the vascular layers of the skin include the blank and blank. Number three, in the rule of nines, the entire head is blank percent. Anterior and posterior torso are each blank percent. Each entire arm is blank percent. Each entire leg is blank percent, and the genitals are worth blank percent. Number four, burns are classified as first degree or blank thickness, second degree or blank thickness, and third degree or blank thickness. First degree burns include the blank layer of the skin. Second degree burns include the blank and blank layers of the skin. Blisters are included in second degree burns. And number seven, third degree burns include the blank and blank layers of the skin. Number eight, youthful skin contains blank and blank, proteins that allow for the skin's durability. Number nine, A, B, C, D, E's of Nevi assessment is important. A, blank. So these are the letter that corresponds with what you should do, right? When you're assessing the A, B, C, D, E's. A stands for blank, B stands for blank, C blank, D blank, and E blank. These are assessment parameters for potential blank. Now the application. Number one, the blank phase, first 48 hours of burn, carries a high risk of fluid volume blank and can lead to blank shock. Number two, hyperkalemia is resolved with the use of normal blank and in some cases blank with dextrose to ensure the patient does not become hypoglycemic. Number three, during the diuretic phase, 48 to 72 hours, fluid blank occurs, and the patient should be monitored for fluid volume blank. Number four, NG tube is placed in patients with severe burns due to the risk of developing blanks, blank. Number five, complications occur in burns when a BSA of blank percent or more and at least blank thickness occurs. We're talking about the percentage of the body surface area and how deep the burn goes. That's when the serious complications may occur. Number six, impetigo contagiosa typically manifests as blank colored exudate. Impetigo is caused by blank, a strong bacterium that is part of our natural flora. Number seven, herpes zoster, commonly known as blank, is reactivated when the susceptible patient is exposed to the blank virus. Number eight, when a patient encounters smoke inhalation, it is important to monitor the patient's blank status due to blank compromise. Number nine, blank, the black mucus created after smoke inhalation, is important to monitor because it lets the nurse know that smoke was inhaled. Number 10, escharotomy is performed to allow for blank circulation. Circumferential burns have a high risk for developing circulatory blank. 11, any burn made to the torso, head, or face should be taken as a priority due to the smoke blank potential. These patients should be monitored for blank compromise by assessing respiratory effort. Number 12, blank poisoning should be monitored for since it cannot be determined by assessing oxygen saturation due to its mimicking of hemoglobin. Thank you, guys.